Why 4 prostate surgeries to correct my urine flow? That is, 2 laser vaporization of the prostate surgery and 1 TURP surgery and 1 bladder neck surgery. It is a long story, so I will begin when I started to lose hours of sleep on a daily basis due to having to urinate 2 to 3 times per night. I cannot remember the last time I slept through the night without having to go. The journey toward my first prostate surgery began when I turned 60. I knew I had a problem when I started going in, as mentioned above, 2-3 times a night. I went to see a urologist for a complete exam, which included a digital exam. We decided that I needed a cystoscopy to examine my prostate bladder on the inside of my body. What this means is that a scope with a camera is inserted into your penis and then slid along the urethra. The first stop is at your prostate and then your bladder. I did not want this procedure to be done at the doctor's office prior to my first surgery. I had heard all kinds of horror stories about this procedure. So I was sedated at the hospital and the procedure was performed. There were no effects after the exam. My diagnosis was anatomic obstruction of the prostate, or I had an enlarged prostate, which was interfering with my urine flow. The doctor suggested that I try a medication program before considering surgery. Well, Flomax did not work for me, as I had a reaction to the drug. Plus, I was concerned with the long-term effects of the drug on my body. Hence, the doctor indicated that I was a prime candidate for KTP, laser vaporization of the prostate. The doctor explained to me that this procedure was safe and effective method with less blood loss than the TURP, which is the transural resection of the prostate. TURP is a procedure that is known as the gold standard of treatment for enlarged prostates. It is often called a rotor-rooter job, and I hope you get the drift. Moreover, he said that my recuperation time would be much faster, but that I would have to wear a number 22-inch French Foley catheter strapped to my leg for approximately 5 to 7 days. This bag collects your urine flow. Medication Percocet was included because of the pain of wearing a 22-inch French Foley catheter and post-surgery pain. When wearing this device, one feels like going 24/7. Finally, I agreed to have the surgery, which was the first of 4 prostate surgeries performed on December 29th, 2005 at 3:30 p.m. Thank you, and I have a few more comments to end this video. Okay, there's one more drug I wanted to mention, and it was Avodart. You've probably seen it on TV commercials. Anytime you're watching sports, they always come up with Avodart, just reminding you that you're going to have a problem with your prostate if you continue to live, and if you are a man, you will have problems with it. So they always remind you. The thing about Avodart is you don't know the long-term effects on that drug on your body. Men, see your urologist. See your urologist, and yes, the exam is uncomfortable, but let's face it, I'd rather be uncomfortable than dead. Please visit my website. You see on your screen now, http:// laser vaporization of prostate. Take care and take care of yourself. See you in the next video.